Welcome back. Day 26 of the 27-day mobility challenge here at the Reprogram. We are almost at the end, and we are moving on to the ankles. We are looking at this essential range of motion necessary for our ankle joints to function in a healthy, happy, efficient manner. Whether you are starting a physical training program, whether you are in the middle of a physical training program, whether you have a physically active job or just performing day-to-day tasks, you need this range of motion to function effectively, okay? And this range of motion minimizes the risk of injury and it minimizes the degree of damage. It can be the difference between a muscle strain and a complete tear. All right, so the test we are going to look at today is the heel sit plantar test. Okay, so we are measuring the amount of plantar flexion in our ankles. And when we limit this range of motion, or when we have a restricted range of motion in plantar flexion, we are predisposed to a few common symptoms. One of them is Achilles tendonitis. So if you can imagine, if you imagine this is my ankle, and I put my foot on the floor here, if I can't point the toe, the muscles on the back of the foot are going to be in a constant lengthened position, okay, or they're not able to shorten, right? So that means we get an overstraining of this Achilles tendon, and over time, particularly over every step we take, we are going to get inflammation build up and tendonitis symptoms. So that is key in that particular diagnostic. Another one is, if that is the case, we're also going to be predisposed to calf strains and tears. Okay, so, and then working into the actual joint itself, if I'm missing that plantar flexion, the ability to point my toes like a gymnast or a dancer, if I'm missing that, if I can't actually get that full plantar flexion to raise myself up onto the balls of my feet, that is then going to predispose me to also like anterior joint or ankle joint compression and anterior joint impingement, anterior ankle impingement, because then I've got, not only do I have the calves, the posterior muscles in a shortened position, but I also can't actually get the length I need in the plantar side, on the anterior side, which is then going to be fighting against the tightness of the anterior tibialis, the shin muscles, and it's going to compress the joint, so that when I am trying to actually mobilize that joint, I will most likely feel it in the anterior tissues. And then to finish off with that, we are looking at shin splints. So shin splints is basically an overuse of these anterior compartment muscles. And let's imagine if I'm taking a step, walking or running, whatever, if I can't get that push-off phase of human gait, if I can't get that push-off phase if I don't have an efficient push-off phase, I'm going to be subject to early swing through and poor shock absorption. Okay, so there's a poor shock absorption and push-off phase when I actually get that swing through when I'm walking forwards or running forwards, whatever. And it just means that anterior tibialis is going to be prone to overuse, overstrain in that shortened position. I can't ever get that length I need for the calves to contract properly, bring the heel up, and get that spring in the step, if you like. So for you guys at home, it's particularly like sports guys, we see it very commonly in football or track and field sports, very tight in the ankles, and it's super important. So what we are going to do is I'm going to show you the test, the heel sit plantar test, and I'm going to run through that with you now. All right, this is the modified version of the ankle plantar flexion test. Now, traditionally, you go to the physical therapy clinic, you lie on your back, and they basically grab your feet and passively push those feet into a plantar range of motion, trying to analyze the range of motion you have between the toe, that angle between the toe and the shin, whether you have that adequate range of motion here. Now, at the Reprogram, we like to always go one better and actually have, not only have you do it, but actually place you in a position where you are actively loading those tissues so you get the right biofeedback, and it lets you know exactly what tissues, whereabouts are causing the restriction. Okay, so as a screening tool, this is really good, and it's pretty simple to do. So take your shoes off. As you can see, I'm not wearing shoes. You are going to get up into a kneeling position. You're going to have your knees together, okay, knees together, and all you're going to do is point your toes, keeping your heels together here, and then just sit back onto your heels, and that's the test. That's it, simple as that. And what you're looking for is try and get the feet down, the heels want to be directly underneath the sit bones, your butt bones, okay? And then there wants to be no air gap here, completely flat, and that is a pass. That is adequate plantar flexion, right? Now, a fail would look like usually one of two things. They either A, can't get the feet down, they're missing so much range of motion here, they're so tight that there's a big gap here underneath the feet or underneath the shins. And then the other fail is that they can get it down, but not quite enough to keep the heels in, and what happens is they get this heel turnout away from those butt bones, the ischial tuberosity. That's what happens, and they end up overly rolling. And that's why I really like this test more than the passive one, because usually in clinic, when you push down the feet, and the feet have a habit of turning in when you're trying to really analyze that last bit of plantar flexion range of motion, and that is the actual giveaway. Okay, whereas if you bias that out and stop that from happening by keeping the heels together and sitting on them, you then get a real good feedback of where that restriction is. Either it's through the top of the feet or up the shin, the anterior tibialis. All right, and of course, that test doesn't just assess the ankle, it's also going to look at either problems coming upstream to the knee. So you're looking at patellofemoral pain again, like overpronation in the foot. So it's going to sort of load the MCL during sporting activities. And also with ankle upsets, we also get a bit of popliteal irritation, inflammation at popliteal fossa there, the back of the knee. So that is a test. Pretty simple one today. Thanks for listening. If you like what I'm talking about and you like what I do and you want to know how I can help you, check out www.thereprogramonline.com. See you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of the Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine a life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.